Hello, everyone. Welcome to Keeping in Touch. This is a weekly series talking about all sorts of things with all sorts of people. I am Cindy Rubin, and I am a pediatrician and breastfeeding medicine specialist, and I have a practice outside Chicago. And welcome to today's episode. Today, I am talking with Robyn Reise, who is an occupational therapist. She works right now at Sensable Kids, which is an OT practice in the Ravenswood area of Chicago. And she has practiced in a variety of different settings, including NICU, early intervention, and now is in private practice. And she has extensive training in sensory processing, torticollis, therapeutic listening, rib cage mobility, neurodevelopmental treatment, and therapeutic handling, praxis, infant massage. Oh my gosh, this list goes on and on, doesn't it? Floor time, feeding, visual processing, and specifically craniosacral therapy, which is something that is often very helpful for our breastfeeding patients. And we're going to just today about her practice and how she can help for my viewers. So welcome, Robyn.
Thank you
for being with me. So to start, can you just tell me kind of how you ended up where you are, how you got interested in the field of OT, and more specifically, the sensory issues that you work with?
So I started off actually when I went to college wanting to do medicine, and I always knew I wanted to do pediatrics. While I was in school, I also became really interested in psychology as well. And so then I was debating what to do. And then I happened to observe an OT and started learning about OT. And I thought that was like a nice interception between the medical side and then the psychology side, the emotional side. So after undergrad, I went to graduate school to get my master's in occupational therapy. And then in terms of craniosacral therapy, when I was working at a clinic, probably maybe 13 years ago, there was a woman who came in from Wisconsin who came like once a month to do craniosacral therapy for the kids that were there. And I was seeing some really nice changes in the kids. And it was just very gentle. And I spoke to her more about it. She did like a little intro class for the clinic. There were a couple of therapists who had already started doing some training. So I started talking to them about it. And then I started taking some classes and started learning more about it. And then kind of the rest is history, and I've been loving it. And I love it for so many things, and especially the babies, because it's very gentle, it's non-invasive, and it's just a really nice modality to use.
Yeah, that's great. Can you actually tell us a little bit more about what craniosacral therapy is?
Yes. So craniosacral therapy is a very light touch manual therapy. If you were to think of like the weight of a nickel or like to what you would touch your eyeball with, that's how light of a touch it is. And the craniosacral system is your head all the way down to your sacrum, your tailbone, with your spinal cord, your vertebrae, all the cerebrospinal fluid that your brain and spinal cord float around in. And it looks at if there's tension or restrictions within the body, whether it's within your nervous system or externally. Everything's in our bodies connected. Everything's connected through fascia. So if there is tension in the body, then it's going to impact our function. So depending on where the tension is, it can create strain patterns. So I think about, for example, the tongue ties that I often see, those adhesions will create strain patterns throughout the body, even all the way down to the feet. And the craniosacral therapy basically works on releasing tension. It also taps into your body's natural ability to heal. So it taps into the healing system, and it also helps to rebalance the nervous system as well.
Wow. So it seems like it could be helpful for so many different things.
Yeah.
With the tongue tie babies in particular, it's something that I certainly see a lot of in my practice, or just something that is affecting a baby's ability to breastfeed.
Mm-hmm.
Do you feel like you are often used in connection with procedures that are being done, or do you find that the craniosacral therapy often does the job in and of itself to help with those tensions?
Yeah, I've seen babies before a release and I've seen them after. I think that the craniosacral therapy does a really nice job of releasing tension in the body. I think for some babies, it can release enough tension to be able to function, but it's not going to get rid of that tie. So I think that I've had families that have wanted to come in to see what we could do with craniosacral therapy first and have seen some nice gains with that. I've also had some that it wasn't enough. So then they went on to go get a release in order to get the rest of the mobility that they needed for their tongue and the oral motor skills. I think it really just depends on the baby and how deep the tie goes, and also what other adhesions are going on in the mouth as well.
Gotcha. And I'm curious, if you have a baby that you see before and after a release, can you tell right away, like, baby still may not be using their tongue quite right, but oh, I can tell it's mobile? Or does it still take a lot of work before you recognize the change?
I think for some babies, especially ones that are the tighter ties, you can definitely tell the difference. And you could also feel it sometimes through the body as well, because so much of that tension, with that adhesion is there. And then once you kind of release it, it does release some of that tension. There's still the strain patterns that we have to work through. And beyond just even the craniosacral therapy, even just with the release, they still have to work on the oral motor skills afterwards, because the baby has learned so far the sucking and oral motor patterns based on with the restricted range. And so they have to kind of relearn that. It's like that motor learning they have to relearn after the release.
Right.
Often the release itself doesn't just do it, but they have to do the therapy afterwards to work on the oral motor skills and relearning those patterns.
Yeah, I hear you. I remember when my daughter had a tongue tie released, I felt like her tongue was just lolling around in her mouth afterwards. And she had kind of figured out how to do it her way before. And then she really didn't know what to do. And I didn't know that much about tongue ties at the time. And I did not know anything about the body work and all of that. So we didn't do any of it. And I would definitely do it differently if I could go back. It makes so much sense that babies need to kind of start from the beginning again once there's a release done. So I think that's a really important point to drive home for anybody watching this who is considering having a tongue tie release done, that there's more to it than just the procedure.
I mean, on occasion, there might be some babies that they just need the release and it's fine. But I'd say the majority of the babies I see do need some help afterwards.
I think if it's done very, very early and the baby hasn't been able to learn that bad behavior, I always say first, it's probably easier.
Yeah. But even so, think about they're sucking in utero. So, I mean,
it's true.
They're still using that. And the other thing I noticed that goes along with these babies is that often there's asymmetry in the body. So the tension in the body can create some asymmetry. So that's something else we kind of work on through the craniosacral therapy with releasing the tension, but also just through other techniques that are more from my OT hat that we'll incorporate too.
Yeah, that's fascinating to me as well. I just remember as a pediatrician, I see torticollis a lot. So torticollis, for those of you who don't know, it's when the muscle in the neck is tight. And so oftentimes in babies, we'll see like a tilt of the neck or a turning of the neck one way, and it's harder and painful to turn the other direction. And that can affect all sorts of things, including feeding. But I knew to send the baby to, usually it's PT, at least first, that I would end up sending a baby to. And then the parents would come back and say, yeah, well, we're working on all this. He also moves his left leg less than the right. And I hadn't realized torticollis is usually not torticollis alone, that there are other things going on.
Yeah, I mean, it affects your sensory system. So if your head tilts, it impacts your vestibular system, your overall orientation of your body in space and how that develops, and sometimes your visual system and those ocular motor skills and how we process vision. It affects the entire body and different systems in the body too. And that even through development, it can pop up. So it can look like it can resolve, but then they go through another motor milestone or developmental level, and you start to kind of see it pop up again. So babies just to kind of keep an eye on as they're going through.
Yeah. Fascinating. So tell me about the link with breastfeeding. I mean, we already talked a little bit about tongue tie specifically. For people who are having problems with breastfeeding, which are the patients that you feel like you either see most often or can really help and should come seek you out?
I'd say a lot of the time I'll get referrals from lactation consultants because the baby is having issues with breastfeeding and they're not sure what else is going on. And so they'll come to me and I'll do an evaluation or a motor, but also the entire body to kind of see what's going on. And then depending what's happening, kind of go from there. So sometimes it could be that they come and there happens to be an adhesion. Sometimes for some reason there's tension or asymmetries or just something, because even the birth process can create tensions and patterns in the body too. So I look at that. Sometimes it could be maybe if the baby's lower tone and they need some help with kind of working on or a motor with tone and also throughout the body and positioning a baby that is lower tone. But with that said, it just also depends where the lactation consultant is too, because they might already know all of this. So it could just be coming to take a look to see if there's anything that I can add to what they're doing. So I usually will hear about like where they've been and what they've been looking at and specifically what they're looking for when they refer to me. And then I usually end up collaborating. So looking at where they're looking, but then what can I add? So we're kind of, can't think of the word right now.
Complimenting each
other. Yes, thank you. So it just really depends on what's going on. Sometimes if there's state issues and the baby's having a hard time organizing, that's another big one where they are having a hard time organizing in order to latch or sustaining a breathe pattern, and they're looking at everything and everything seems to be fine on their end. So then they come and maybe it's a state control issue. Maybe we're looking at the baby's sensory system and regulatory system and seeing if we can kind of help organize them and working with the parents to help them better organize the baby so they can organize and latch and breastfeed.
So, something that I see frequently just as a pediatrician is that fussy baby, like just really fussy baby, maybe with feeding, but not just feeding. And as a pediatrician, I reassure and I reassure and I reassure. And I do obviously make sure that there's not something wrong as far as the kinds of things I would look for. But I always feel bad that I can't really offer a treatment necessarily. Is that a baby that I could send to you?
Yes. So I see babies, I think, one, we can do craniosacral therapy with them because craniosacral therapy helps to rebalance that nervous system. And depending on what's contributing to the fussiness, we might be able to address some of those other issues, whether it's some GI stuff that's as they're trying to figure things out or other things that might come up. But also from a sensory standpoint, we really look at, as an OT, looking at how the baby takes in information and how they process it, whether it's internally or externally from their environment. And how do you work on regulating that baby? What are some techniques that we can do? And what can I help the parent, one, learn about the baby's sensory system, so then when the baby's showing us cues, we can kind of see and understand that a little bit better. And then having those tools to say, oh, I'm noticing this, I'm going to try this. So they can support the baby. And then what you're doing with that is that you're kind of rewiring the nervous system. You're helping the baby organize and find that regulated state.
Oh, great. Well, you're going to be getting a lot of referrals from me because I know that can be very hard. I'll often say, well, you might have this might be a personality sort of thing, but we shouldn't be leaving it at that. So that's really helpful.
Yeah, I mean, there's so many reasons why a baby could be fussy. So I think it's helpful to be able to partner with you or whoever the pediatrician is, because from the biomedical standpoint, is there anything that is contributing, and to rule all of that out too?
Yeah.
And then kind of go from there.
Yeah. And I think you touched on something earlier that I think is so key, which is there's such a large team of people who can help with problems in general. But when we talk about breastfeeding, there's so many different components and so many different people who can help in different ways. And I think we as breastfeeding professionals need to work together And we all have these complementary skills and services have to offer. And not every baby needs all of it, but hopefully we can work here in Chicago to build a closer connected network so that we all can communicate better and make sure that patients get to where they need to be. I guess that'll be the next thing on my list.
Yeah, I love collaborating with other professionals because everybody comes with a different background and the lens that they are seeing this baby and actually the mother and baby dynamic.
Right.
And so I think it's helpful to be able to talk about it and kind of looked at from different perspectives to really get a sense, a bigger picture of what's happening, the unit together.
Right.
I love that.
Yeah. So we've kind of focused on babies and craniosacral, but Sensable Kids services a lot of different issues. It's all pediatric, right? Sensable Kids.
Yeah. We see some adults, but it's mostly pediatrics.
Okay. So tell me just generally what the spectrum of conditions is that you guys would see kids for. I know it's broad.
Well, so Sensible Kids is multidisciplinary. So we have OTs, we have speech language pathologists that work there. We also have developmental therapy as well. We have a clinic in Ravenswood that we see clients through, or we also go into people's homes. So for early intervention, all of our providers are early intervention providers as well. So we see kids through early intervention program. We also see some kids privately if it's beneficial for that child to see them in their home or at a school or in their daycare, or if there's another setting that would be where their child would benefit from having some intervention. And so we see basically from birth through adolescence. We've had a few college age, we've also had a few adults, but mostly it's birth through adolescence. We see kids for developmental delay, speech and language delays, and processing disorders. We see kids for sensory processing differences and regulation challenges. So a lot of kids that have emotional regulation difficulties. We see kids with anxiety, kids that have motor coordination disorders that for some reason they're those kids that just don't seem coordinated, but they're not quite sure why. We also see kids that might be struggling in school for whatever reason that might be, whether it's academically, whether it's being able to participate and attend in the classroom, whether it's socially with their peers, kids that have a hard time just getting through their day, where you just feel like they're working hard and the parents are working hard to kind of get them through their day, and all different types of the range of diagnoses that you can think of that will affect our kids, anywhere from like congenital diagnoses all the way through more neurodevelopmental differences as well.
Okay. Wow. And so if somebody's watching this and has a kiddo who's being evaluated for early intervention and they live in the Ravenswood vicinity, can they request to see a provider that's Sensible Kids?
Sure, they can let their service coordinator know that they would like a provider from Sensible Kids, and then they would contact our clinic to see if we have a therapist that has availability, and that we would then reach out to the family. That therapist would reach out to the family and see about scheduling to see if it would work for the family schedule as well. And then if a person who's watching also is not quite sure if their child would benefit from OT or speech or even developmental therapy, they can always call our intake coordinators. Is wonderful as far as speaking to parents and kind of getting a sense of what's going on to then be able to recommend, kind of help guide the family of what should happen next.
Yeah. That's great. I mean, one thing I always tell parents, I like to err on the side of, I mean, that's why it's called early intervention, right? The earlier we intervene with developmental issues, the better the outcome. And when a parent's unsure whether there's a problem, or when I'm unsure, it's kind of like a borderline sort of screening test. I always say, especially the early intervention program, if you're not familiar with it, is a state-run program. It is state funded, and the evaluation is free. So at the very least, you can have the evaluation. And the worst thing that happens is that you lost an afternoon, but you didn't even lose it because in the end, they told you everything was okay. And so you can be reassured and sleep better at night. And then if they find something, then they find something that you can actually do to help your child. So if you're on the fence, there's nothing to lose. That is for kids who are under 3. And once you hit 3 years old, that becomes part of the purview of the local school system, which is sometimes a little harder harder to navigate. And then there's always the private therapists as well. And it sounds like you can get everything, all of those things at Sensable Kids if needed.
Yeah. And just to kind of piggyback on what you were just saying is that for me personally, I like information. So it's really just getting information, and then what the parent decides to do with it is completely up to them. Right. So if they make recommendations, it really is up to the parent to decide, is this for us? Is this something that I want to pursue? Or do I have another idea of how I want to move forward?
Right.
It's information.
Yeah. Great. So I'm going to switch gears because I think we've got a pretty good idea. And I mean, you've done a great job of explaining what you do and how craniosacral therapy can help and what services Sensible Kids offers. So I want to switch gears, just to something a little bit more fun. So how long have you lived in Chicago?
I moved here in 2005. And then we moved in 2009 for a couple of years to Portland, Oregon, but then came back in 2011, and I've been here ever since.
Okay. All right. So what is your favorite thing to do in Chicago?
It would definitely be when the weather's warm. And
yes.
I love being out by the lake. I love water, and even though living in a big city, I love nature. So I like spending weekends by the lake, or there's a restaurant that we like near us that's on the lake, and it's just fun to sit in the evenings, and you can bring your dog and they can sit out there with you. I'd say I love that. I also love being downtown when it's nice out too, and just feeling the energy of just being downtown too.
Yeah, for sure. For sure. And just for context, right now, it was 0 degrees this morning when I woke up here in Chicago right now. So yes, I'm dreaming of that warmer weather too. And it's like I'm in my kitchen and it's just freezing.
Yeah. Winters are not fun in Chicago. And every winter I think about wanting to move out where there's somewhere warmer. But then when spring hits, it's like, I love Chicago.
I know. I always say that in Chicago, we know what the weather is like. I mean, many of us have lived here forever. We know that the winters are cruel, but we still complain about it. We love to complain about the weather. Yeah. Okay. And so next is, what would you tell your 20-year-old self if you could go back and talk to her?
I would say that everything has a way of working out. Take your time to enjoy the process and just living and being, and don't rush through things. Take time to learn about yourself and what you love and where your passion is, and just to get to know yourself rather than trying to rush through everything in life.
Yeah, I think that's very good advice.
Still trying to keep that in mind.
Yeah, I know. It's easy to say, but it's harder to do. I know. Great. Well, this has been so helpful. And I think, just coming from, again, the vantage point of a breastfeeding medicine physician, what do you think we can do, or what would you like us to start figuring out how to do in terms of collaborating with other breastfeeding people? What do you think would be helpful for you, and how can you help others?
I think hearing about what people do and what they have to offer in terms of not only their services, but just their background and their perspective when looking at clients and families, I think that's really helpful. And then I might have a general view of what a lactation consultant is, or a pediatrician, or another discipline that might be a part of the team, but really hearing about the backgrounds. I think having dialogues about clients, but just about breastfeeding in general. Mm-hmm. I love learning about just having discussions, and multidisciplinary discussions, I think, is the most helpful, because then you get so many different perspectives on the topic too.
Yeah.
And to talk about topics that are impacting breastfeeding as well.
Right.
I think for me, those are the big things. And just continuing to take education and courses from different disciplines too, because that definitely is a big difference than just only taking from an OT perspective as well.
Right. Yeah, I think that's really important. And I don't know how good of a job we're doing of that in Chicago. And so maybe we really do have to work on that. I mean, I think lactation consultants are clearly on the front lines, which is fantastic. And it'll be good for all of us to work with the lactation consultants so they know of all of the different places that they can send their patients in different situations.
Yeah, I mean, I think it's so important to keep the communication open and just collaborating and just talking about what we all can do, because I think it's so important, because I just feel like to be able to provide comprehensive and well-rounded care, I think sometimes it takes a team.
Absolutely. Absolutely. Great. Well, so if somebody is looking for you or looking for Sensible Kids, how can we find you?
Well, you can look up Sensible Kids online. We have a website that they can check out to take a look at our services and our therapists and the approach that we use when we treat, which is a more relationship-based approach. So it talks about that. We also have some resources on our website, and it also will tell you how the best to contact if anyone's interested in services or just has questions too.
Okay, great. And I will put the website and everything into the notes from today. So great. And if anybody has questions, feel free to put them in the chat and we will look back after the lecture and answer anything that you're curious about. So feel free to throw things into the chat and we'll address them later. Well, thank you so much, Robyn. It was so nice to have you on, and I've known of you for so long, and hopefully we'll have a chance to meet in person one of these days. But this was very nice to get to know you a little bit better and hear what you have to offer.
Thank you so much for having me.
Absolutely. Thank you, everyone, for watching today, and we'll see you next week on Keeping in Touch.